Well, as Mark mentioned, I'm a pediatric cardiologist, so this time of year I'm seeing a lot of those kids that come in with lightheadedness and chest pain and want their football clearance. And I'll say, what did you do all summer? And they'll say, not very much. And now you're trying to go out there and be the football star of your school. I know I played, for better or worse, I joined a over 40 soccer league with a bunch of lady friends up there in Lansing, and I'll tell you what, I had chest pain, I had lightheadedness, everything. So when these kids say I have chest pain when I exercise, I never am quite sure what to do with it. And of course, I'm not in the place here where people get all kinds of unusual situations. I'm out in the real world, and not a day goes by that a girl doesn't come in who's fainted. And so the screening piece is, I've found, extremely challenging for reasons that a lot of people have said. And I know there have been efforts over the years to donate AEDs in the schools, and I wondered who had them and who didn't, and did they know what to do with them? And one thing we haven't talked about is maintaining them. Who's checking the batteries? Who's checking the pads? Do we know that they're going to work when the time comes? I'll apologize because I'm going to skip over a bunch of slides because people have already covered it and we are running short on time. I did this survey with a pediatric resident who's now a pediatrician in Lansing. I think I saw him here earlier, and an MSU undergrad that worked with us to just find out what the schools are doing these days. The current guidelines that just came out in February 2011, there's a paper that's in circulation that has the endorsement of the American Academy of Pediatrics as well. I would like to recommend that, so this is the Heart Association and this is the American Academy of Pediatrics, and there have been prior recommendations, but stronger as we go, saying it should be required as a graduation requirement in our high schools. And this paper I'd refer you to, which is in the journal Circulation, February 2011, gives guidance in overcoming implementation barriers for this sort of thing. This was mentioned earlier. A lot of what I say is really sort of reinforcing, especially what Darryl said earlier. Effective CPR can prolong the window for successful defibrillation, but it is a shock, not the CPR, that reverses a lethal arrhythmia. Do we know that everybody that passes out has a lethal arrhythmia? No, but that's where the AED will tell us if that's the case. This is sort of interesting to me. This is from that same paper. In 36 states, not Michigan, but there are 36 states that have laws or curriculum content standards that say CPR training should be part of school curricula. 15 states have no mention of CPR in the legislation or the curriculum, and I'm not going to spend time talking about legislation, even though I'm in Lansing, but maybe especially because I'm in Lansing. Of course, you have these laws, and then you always have to wonder, what about the funding for them? And maybe 36 states have laws that are stated in different ways, but the implementation, of course, even across a given state, is not going to be uniform. Lansing-area events, I guess we all have our sad stories to tell. In the midst of this survey, and I had the results from this particular school, not inner-city Lansing, but one of the communities right outside, I was asked to consult on a boy that had collapsed at a local high school, and similar to what other people have said, he collapsed, and an Eagle Scout, friend of his, he was sitting at his desk in the classroom, said, oh, let me get a mouthpiece, let me do something. He actually had asthma as probably the inciting problem. And I haven't figured out, having talked to the superintendent afterwards, I haven't figured out if it was the teacher or the front office. It was, don't touch. So here's this little boy that knew what to do, or at least had an idea of what to do, his friend. And I consulted in the peds ICU. The child was neurologically devastated. They asked me to see him as a pediatric cardiologist, and Mom said, the friend had come by, his friend's in the hospital, and said, you know, what the school's telling me is not the same as what his friend is telling me what happened. And I about couldn't handle it, but so that's what prompted me to call the superintendent and say, you know, we need to figure out what happens next time. There's not a wide recognition of Good Samaritan laws, but every state has a Good Samaritan law, and the federal government passed a law, as you may know, that covers AEDs on top of every state law. So that, if nothing else, when I spoke to the superintendent, I said there are Good Samaritan laws, and these machines make it very simple. Call me in the fall. This was in June. Well, nobody's called, so I don't know where it left off. But And he wasn't, when the EMS people got there, and this was, not out in the country, he was in ventricular fibrillation when they arrived. No CPR, no nothing, until they got there. And then a patient of mine actually collapsed at day camp this year, and they did good CPR, but the day camp didn't have a defibrillator, and they found she was in VFib when she arrived. She also has major neurological problems that resulted. So, these are our kids. Then the other terrible story was this patient, Darch Dawkins. I don't know if you remember that story from a few years ago. It made it into Sports Illustrated. I know all about that one because I was on the scene for that one too. They actually had an AED, but he didn't need it. He needed a new heart basically because he had an anomalous left coronary that was mentioned as having, instead of 2 coronary arteries, he had 1. And basically had a major myocardial infarction after the longest day of basketball he had ever played. This is a kid that had been written up as the next great high school player who was an 8th grader. So, the screening for him, if I had to guess, the family, he never had any symptoms until he passed out, and the AED wasn't going to do it. And he didn't make it. But I guess the point there is that the screening we've talked about, very tricky to pick up anomalous coronaries, as for some of the reasons mentioned. And in fact, at one of the hospitals I work at, I'm seeing an echo at the end of the day for a kid with chest pain. Kid's gone, came in, had the echoes gone, and I said to the tech, I can't see the coronary arteries where they come off the aorta. I said, when a kid comes in with chest pain, teenager, what do you think we're supposed to be checking for? And the answer was heart function. So if you don't have a pediatric cardiac lab, which of course Ann Arbor has, and Grand Rapids has, if you don't have that awareness and you're just talking about out, not even that far from here, the screening is just very challenging, which isn't to say it shouldn't happen for all the reasons mentioned, but that's what leads me to say, well, what's happening to those kids that aren't picked up by screening? Okay, so I'm supposed to talk about our survey, and I don't want to belabor things too much. I did find this in the Grand Rapids Press. Maybe Daryl knows about it. I just loved it to see this. I just went online and looked up stuff about West Leonard, of course. And the Good Samaritan law sort of is part of these things too. So if I were to talk to that school where this kid didn't get defibrillated by the Eagles, that this whole thing didn't happen or didn't get CPR, these are the things I would say to try to keep it simple. And again, I just Googled West Leonard Foundation, and it's right there. Just beautiful. All right, so what about our survey? Oh, one more slide, and then I'll tell you briefly what we found out about the schools and where the schools are coming from. I did find out that, you can argue about cost effectiveness, but in fact, younger kids, or the majority of school cardiac arrests, although you're more likely to see arrests in the casinos and places where there are older people, maybe, but the majority in the school cardiac arrests are witnessed, so you know right when it happens. And more likely to have ventricular fibrillation than in other settings. I don't know there's any way to really know the percentage, but it's a higher percentage than you might think. And then just guidelines, if you're somebody who's into guidelines. This is from Circulation 2004, and we can ask ourselves, these AED programs that are being set up, do they meet guidelines or not? Number one is if the cardiac arrest is likely to occur at least once every 5 years, maybe not in the average public average high school. Number two, if there's any high-risk student or staff. And number three, if there's a low likelihood that EMS can provide shock within 5 minutes of collapse, for reasons mentioned, and there's a high likelihood that this program that you're setting up can provide it within 5 minutes, then that would be a reason to think about setting it up. So what about our survey? This was the purpose of our survey. What's the current state of AED awareness in our immediate area in Lansing? What are the needs of the high schools? What do they need? What are they looking for regarding maintenance of the AEDs, the accessibility? Where are they, in a locked office or something? And what about training? And the purpose that we were thinking about, and we haven't really gone to the next step, but that's why I'm kind of excited about these people who are thinking about next steps. But we wanted to use the information. Now we have names, contact information. We know who it is at each of the schools. We know that and what their situation is. Maybe we can use that as a springboard to coordinate future efforts. We're about an hour from here, just showing, and I didn't know how many people were going to be out of state. I think most people know where we are. We are in Spartan country. This time of year is a little dicey being in Lansing working for U of M, but what is that? What is that black M on your white coat? So here's our area. It's a little typo here, but 23 Lansing-area schools. We got actually 23 we got 20 responses from everybody. Somewhere, one of my assistants, we kind of misplaced one of the responses, but we were just fascinated, and it was because they kept hounding the schools. We actually, I should say, we worked with the Red Cross, the Mid-Michigan chapter of the Red Cross, and that was our entry point. We're working with the Red Cross. We want to know what the schools are doing. At one point and another, the Red Cross is having other issues up there, so they were like, well, we don't want to really be advertised, but I do need to give them credit for being our entry point. I think people were more likely to respond to that than just someone saying, hey, I'm a doctor, I'm trying to figure out things. And many of the schools had worked with the Red Cross, so they were anxious. They were eager to participate for whatever reason. So we found that all schools in our area, whether you're out in the country, Stockbridge, Corunna, wherever, or inner city, everybody has an AED. And many of them were donated. Prior surveys, we've asked what's donated. Probably half of them were donated. The Guillory Foundation in the eastern side of the state. There's also a cardiology group in town, TCI, who does a lot of pacemaker work, works closely with companies. I don't know. They got things at a discount, and they reached out and made sure the schools had them. So they came from a variety of sources. Some were bought. Most schools the majority had 1 or 2 AEDs in the school. 2.3 was the average. And in the comments, most were said to be bystander accessible, but some not necessarily in an ideal location. We asked who was responsible, kind of a gamut of people. Some didn't know who was responsible. What about the shock pads and batteries? Well, over a quarter of them didn't know if the pads or the batteries were any good. So that's a little troublesome, I think. Do you have a written EAP? Lisa had mentioned earlier about this emergency action plan, and half had a written EAP. The other half did not, or almost half, or didn't know, or just had a verbal plan. My understanding is that teachers need to be certified to start in the schools. I don't know if there are teachers here that can say whether or not that's true, but we asked about recertifying. We had actually done a study years ago and kind of got that from that, and then we're just trying to look a little more closely. So what's the certifying policy if you've been there for how many years? And so many of them didn't know, or there was no recertifying policy. 35% were other. I think some of them did say they had every 2 years recertifying. But AEDs have come along, and people that got CPR certified 10 years ago, that wasn't as much of the discussion, and now it is. So I think that's another problem. Do you practice your emergency response? And I like this idea of these drills that people are talking about, like fire drills. Do you practice it at least annually? The majority know or don't know. I found some of these comments helpful, not to belabor things, but it says most teachers would simply call 911 and send a student runner to the office, then call the main office. I think that's what happened with our little boy that collapsed. They had to get the main office involved, the teachers calling 911. I think they did all that. But, they said a boy fainted. Well, kids faint in high school a lot, and I'm not sure, there's just a lot of things that went wrong. So a little bit all over the map. Some do an AED drill week, they said twice a year, so it's kind of nice. Now, here's what I thought was interesting, and I don't know how well this projects, just getting towards the end when we said, okay, let's just say the Red Cross could step in and start something in your school. Where should we start? And number 1, 2, 3, 4 in terms of priorities, because we've been talking about teaching students. In fact, the schools are very concerned about the teachers, and that's where they think we should be starting. So I'm not going to make a case either way. Probably we should be doing both, but it was just interesting to me that they thought the number 1 priority should be CPR training and recertification of teachers, and then in that column came in second was new equipment purchase, including replacement pads and batteries. Those are the 2 things the schools are concerned about. In terms of their second choice, it was sort of reinforcing the teaching, the AED teaching, and the AED maintenance. So there was an option to pick students training or student, CPR AED, and that was much lower priority. So just some comments from the people at the school that said they were the ones coordinating, if there was a coordinator. And some of the surveys were answered by the principal. But anyway, they said help would be appreciated to avoid a catastrophe. I've been trying to get my district to move forward with training. We need replacement parts. This is a very important thing. If only one student or spectator is saved, it will be worth having. In our survey results, then, we got a good response, and the schools were eager to partner either with us or the Red Cross or whomever. The schools have AEDs, we found out, but the optimal number we're not sure of, and we're not sure about the placement. And we did ask where they're placed, but you'd have to go into the school to figure out if it's logical or not, or accessible, I should say. They have concerns regarding maintenance and their own readiness. The optimal training procedures need further explanation, and 2 instances that I mentioned in our schools, independent of our survey, highlight the need for basic established response protocols. The goal then would be to save adults as well as children. It's a way to kind of get into the community by the schools. Whether or not you think the schools are the place to start for cost-effective reasons, it is a way to kind of get kids interested and potentially their families as well. Of course, there are challenges always, as others have mentioned. I think we need to think for a minute about ongoing training. In case an athlete dies and we rally, but we need to think past that and decide how we're going to, and maybe that'll come from this. How do we keep it going? There are scheduling issues for training and training the trainers. Do you want to integrate it into the school schedule and health classes or teacher in-services? How do you want to do that? And then this is my last slide. Just thinking in my own mind about next steps. Again, this is different from the screening, but just the whole CPR AED situation. Can we have a central processing group that supplies a structure to help the schools develop and maintain their programs, supporting coordinated training of staff and/or students, support schools creating their emergency response plans? Maybe they don't know where to start. We've seen that the health activity questionnaire is a little outdated in one place, and if we can streamline in this day and age, the electronic day and age, that might be something that we can somehow offer. Maybe coordinating efforts to raise money for the purchases, planning and follow-up, and then in my area, maybe exploring external resources for making these things happen. Thank you so much for your attention.